Thank you for that. Finding quality health care in the foothills is hard enough.
But when you're pregnant, it can be nearly impossible. Mariposa County, for example, does not have any OB/GYNs or a birthing hospital. CBS 47's Dennis Valera shares two programs trying to help women get the care they need in this Eyewitness News special report.
The John C. Fremont Healthcare District stands as Mariposa County's only hospital. In the last couple of years, it has bolstered its imaging services. The newest addition, this top-of-the-line machine that helps detect bone diseases. But something you won't find inside these halls, a labor and delivery department. The hospital stopped offering this 30 years ago. The CEO couldn't tell me why.
While John C. Fremont can provide prenatal care for mothers-to-be in the county, they still have to head outside of Mariposa County to be able to get specialty care from an OB/GYN or to deliver at a hospital. This causes many to go back and forth between Merced and Fresno.
Katie Rule was one of those mothers. Her first child, Gracie, was born in 2007. Her second, Evan, born in 2010.
I got a midwife in Oakhurst, and then I delivered in Clovis, but for my second child, I had to go all the way to Fresno for every single appointment, everything.
Mariposa County does have other programs that help. Katie went to the Smart Start program.
If I didn't have the program, I wouldn't have gotten the prenatal or postnatal care that I had. I wouldn't have had somebody come in and checking on my kid.
Run by the county's Health and Human Services Department, the program brings nurses right to patients' homes, supporting moms from pregnancy up to when their child turns 5, going over everything to make sure the mother and child have a healthy life.
The visiting nurses do not take the place of the actual visit to the doctor for a prenatal care provider. Having this service and being a support to the moms is very critical.
The nurses also encourage mothers to keep up with their appointments. Doctors say expectant moms doctor an average of 8 to 12 times. Missing this care is dangerous for the mother and child.
They could have miscarriages first and second trimesters. Also, if addressed early in the pregnancy and screening for that and doing the surveillance for preterm labor, preterm delivery would also decrease some of those outcomes.
The distance, King says, is the biggest obstacle for the county's mothers. From the town of Mariposa, the closest OB/GYN is 45 minutes away in Merced, even farther to Fresno. It's similar for those in the northern part of the county. Most travel to Sonora.
Or most of our moms, they're limited in their resources, either financially or they don't have a car.
Are you kidding me?
Helping Hands has been working to keep true to its name. Founded in Oakhurst in 1998, it expanded into Mariposa in 2014, offering free parenting classes to new and expectant moms. They're given new clothes, diapers, and other essentials when they attend enough classes.
The classes are designed to help people connect with their kids, to learn about compassion.
Just like Smart Start, the program acts to complement doctors' visits, making sure their clients are on the same page as their healthcare providers, all with a personal touch.
What I would say to my friend or my sister, you know, I'm really concerned. I've noticed some things. Have you talked to your doctor about? Would you like me to go to the doctors with you?
Helping Hands continues to grow each year. Last year, it hosted 415 classes. This year, it's already held nearly half of that.
Is there any concern with the shortage and then the need for this program to continue?
Yes.
Increasing needs for care for pregnant women in the county isn't lost on the Health and Human Services Department, especially as a majority of its workforce is getting ready to retire. King says the way to fix that is mentor the future.
The hope is reaching out to our to nursing schools and other community partners to explain what other nursing fields there are, such as public health nursing.
Margarita King says the department is currently short 2 public health nurses, about 55% of the nursing workforce. More information on the programs in this story will be online at yourcentralvalley.com. Dennis Valera, CBS 47 Eyewitness News.
Well, that's something you just take for granted living in a metropolitan area, and you don't think about places that don't have that care.
The name says it all, Helping Hands.
Yes.
Great report, great program. Coming